Well, hello. It's Monday. Aren't you so excited to start your week?
Never.
I'm here with Dr. Murphy, and we are just so excited to bring you some Mythbusters today. And we've got a pretty good one. A pretty good one for your big brain.
Right.
Okay. So the thing is this, if you haven't been around the block and seen what we do here, we have a question. He's either going to bust the myth or prove it to be true, and then there
Or I can say I don't know.
Or you could say I don't know, which sometimes happens, but I think you're going to know this one.
Okay.
Okay, are you ready?
Lay it on me, sis.
Okay, so here's something kind of cool. So, there were researchers who studied concussions for the last 25 years about managing concussions, specifically in children, and tried to decide what procedures are the strongest for evidence that helps benefit concussions or helps to be most effective if you have a concussion. And the big thing is, apparently they said, now let me make sure I have my information right. They said the big thing is rest, true rest, okay? Identifying it correctly to begin with, because they said a lot of people think you have to be totally knocked out to have a concussion, which is not true apparently.
It's not.
Then they said that there's a lot of potential risk from CT scans, which they don't really feel like has been shared with parents. Or at least they don't have the correct information when they're trying to decide what to do. So I guess my big question is it true, Dr. Murphy, that rest is the best medicine, that parents should be more informed on what CT scans are and how the radiation part works, and is it really like a mild traumatic brain injury?
Yes. And your brain can recover. The younger you are when you have a concussion, the more your likelihood of recovery is good. After the age of 18, when you start entering into college sports, the concussion rate and the injury from it will be greater. When you're young, your brains have a tremendous amount of recovery, and I've seen children with strokes that have wiped out half their brain. 3 weeks later, I can't tell them anything's wrong with them.
Whoa.
Incredible recovery. But when you get older, like me, concussion, that's
Takes longer to heal.
Yeah, well, it probably won't heal.
Oh.
And a lot of people get confused what a concussion is, and it's different ways. There's bruising of the nerves, but more importantly, you stretch them, you pull off the connections, and they have hard times reattaching. And so you can get a lot of different long-term sequelae. Muhammad Ali, he developed Parkinson's as part of a traumatic concussion. But you can get concussions, and you do get them from headbutting soccer balls, football. I mean, I'll be honest with you, I like football as much as anybody, but I was scared to death out of how much I like football. I mean, in soccer, it's just as bad. Anything to where you get hit in the head without a significant amount of protection is going to be bad. Anything that jars the brain. You literally have to remember your brain is like Jell-O, literally like Jell-O. And if you sit there and shake it, you're going to crack it. And if you throw it against the wall, it's going to splatter.
Yeah.
So, and that's what your brain's made of. It's 90% fat, 95% fat. That's all it is.
Jeez.
But it's got a lot of little wiring in there, and you can stretch them, pull them, injure them, damage them, sever them. And so, yeah. Second part of the question, CT scans. Well, in children and even in adults, with just a minor concussion, short of what I call absent of focal neurological finding, like my toes are numb or something like that, I don't think they're going to show anything. And so I think they're probably overblown, and there's probably a lot of parents back there going, oh, my kid needs a CT scan. You can't see a concussion on a CT scan unless it's really super severe and they got a bleed or a bruise or something like that. Then you have to get in contrast, which hurts the kidneys. But the radiation itself with a CT scan, yeah, it's a decent dose. Doesn't bother me. If it was one of my kids and I needed a CT scan, that's the last thing I'm thinking of.
Yeah.
But I'm also need a very good, concise reason to order one. I just don't order it off a whim. Especially if I have a hysterical parent that says, oh my God, my kids need a CT scan. No, he doesn't. Yeah, but they could probably find a doctor that would order one.
Yeah.
I'm just not going to do it.
Is the radiation a pretty big deal?
Not really.
Okay.
I mean, it's a lot.
So it's like not hurt anything, but you don't need
No,
it if you
I don't
need
think
it.
so. I mean, no. But when you get older, I mean, let's look at it this way. I'm not going to live another 20, 25 years anyway, so what the hell? Nuke me with all the radiation you want. What do I care? Thank you for agreeing with that.
Hey,
you are
so long as I can push the button that makes it nuke your head.
Yeah, see.
No, Bobby, the first one being like, okay, you ready to do a Free Advice Friday, Mythbuster, after your head's moved?
Yeah, your true colors are coming out right now. But no, if I had a child, I'd be really concerned about the radiation because there's reproductive, there's grandchildren, and it's all that kind of stuff involved. So I'd be a little more cautious about that one.
Yeah.
So, but children, protect them. Watch the head injuries. And I think the NFL's doing a good thing right now to where you can't lower your helmet when you tackle somebody. I'm glad to see that. So I think changes and areas like that are moving in the right direction. I still think soccer has never been really looked into, and I think that you're going to find that's a serious one too.
Yeah. So do you think rest is the best form?
Yes, absolutely.
And they don't do it very much, especially in sports. They really don't allow the appropriate amount of rest. I read on one, it said for children, you really should let children rest up to 3 months.
Absolutely.
Up to 3 months.
And that's a lot of it, so that the injured part that's trying to heal does not get injured again. And the reason why is because of the cells that are in the fluid of the brain are the ones that do the healing.
Yeah.
It takes them a while to get there and make the healing occur. So yeah, 3 months.
Yeah. And I mean, come on. Most of you guys' kids are not going to go pro. I'm not trying to be a jerk. I've watched a lot of organized sports, and I don't like any of them. Your kids are not going to go pro. So let them rest, because they're going to need their brains for whatever job they get later in life. Like, let's just get real.
Mm-hmm.
And even if they're going to go pro, maybe you should let their brains rest so they maybe can later.
And if you're one of those parents that on the sidelines yell at the coaches and the umpires, or whatever, get some therapy, okay? You need some help. It's just a game. Oh my God, it's not like you get a world championship ring for your kid, so
But good for them for being involved.
Right.
So anyway, cool. Well, that was your question.
Good. So it's true.
It's true. All right. Cool. Well, protect your heads.
Good.
We'll see you next Monday for Mythbuster Monday.